Hey, this is Dr. Alvin Philipose, and today we're going to be talking about the truth about chiropractic and strokes. So, just to kind of lead up to the explanation of where I'm going with this, prescription drug overdoses here in America rose from 3,442 in 1999 to 17,029 in the year 2017. And from there, the number of deaths had declined to 14,000 by another increase to 16,000 people in 2020. So that's 16,000 people that have died from actual prescription drugs prescribed by medical doctors and that have died from that. And we all know here in Oklahoma how the opioid crisis has kind of taken over, especially with synthetic opioids dealing with things like fentanyl and other narcotics, and the roles that both the physicians, the pharmacies, the FDA, everyone kind of played on that. There are different types of drug errors. So, number one, definitely prescribing errors. We see that all the time here at our office from medical physicians doing that. Failure to prescribe the right type of prescriptions, someone receiving a medication too late or too early, medications receiving a drug not authorized for them, improper use, wrong dose, administration errors, failure to take into consideration their actual medical conditions, and overlooking lab tests or other drug interactions, not following proper protocol, medication filling and refilling errors from the pharmacy side, medication administration errors on from lower levels, failure to perform parts of the medication regimen that was laid out for them, failure to follow clinical advice, failure to report information, failure to adhere to the follow-up. So the FDA receives more than 100,000 reports every year. And we all know how the FDA is when they get to pick and choose some of the stats that come through. 41% of Americans report having been involved in a medical error, either personally or secondhand, and more than 7 million patients in the U.S. are impacted by medication errors every year. That's 7 million patients. 10% of hospitals have patients that are subjected to medication error as well. Statistics, if you keep going, there's about an 8 to 25% median medication error rate. And we're just going to keep going through to where 1 in 5 Americans have experienced a medical error while receiving health care. 1 in 5 medication doses during hospital stays are given an error, and about 530,000 injuries happen every year in outpatient clinics because of medical error. 1 in 5 adverse drug events, dosaging errors. More than 51% of parents reported giving incorrect acetaminophen doses. Only 67% of parents were able to accurately repeat back medication use instructions. Intravenous medical error, 48 to 53%. In another study, almost 15,000 pharmacist interventions. 41% of those medication errors involved cardiovascular medications, anti-diabetic agents, and as much as 18 million people aged 12 or older may misuse prescription drugs. Researchers used 4 separate studies from 2000 to 2008, so this is years ago. But if you look at the extrapolated data, over 35 million hospitalizations, medical errors caused 251,000 deaths per year. That's translated to almost 10% of deaths per year are due to medical or hospital error. Let's get into infections. From infections in 2013, it showed almost 100,000 people died from hospital infections. But, you really start looking at patients that ended up having hospital-related infections after surgery. It's almost double that if you start kind of looking at the actual stats, and almost 5 times more likely to return after hospital discharge and twice as likely to die. Now, let's get into chiropractic stroke stats. 1 in every 20,000 spinal manipulations is a stroke stat. That's 1 in 20,000. Most chiropractors see quite a few people. And then, we are taught in med school, in chiropractic school, to look and see and evaluate the same way a medical physician would before they do surgeries and stuff, what we can do to prevent strokes. So here in my office, I use a digital motion x-ray. We do not adjust necks unless you have an x-ray. That is just mandatory. I will run a digital ultrasound to check for other areas, maybe blood flow situations, any type of artery occlusions, any type of risk for strokes, a proper orthopedic neurological exam, minimal to no rotation when I adjust, and I do not over adjust. We have other gentle techniques that we use. And if you really start looking at the stats on how many chiropractors are out there, when you start looking at the stats and our malpractice insurance, the malpractice insurance for me, for example, is $1,000 a year. I'd like you to go and ask your physicians how much their malpractice rate is every year. And the reason for that is everything I do is natural. Everything I do here has research behind it. And if you are truly hurting, you will seek answers. And those are the patients that I'm here for. See, most physicians that do alternative stuff like we do only see 10 to 13% of the population. But only 10 to 13% of the population actually really kind of take care of themselves. They believe in eating right. They understand that diet and exercise is important. They do not want to be on a bunch of prescriptions, because the average person here that comes in over the age of 50 is on a minimum of 8 prescriptions by the time they come see me. So a lot of those physicians that prescribe those medications don't even talk to each other to say, hey, is there any type of drug interaction going on? And if we really want to get into the FDA and FDA approvals, we all know how there are treatments out there that work, but it is always suppressed. And the same people that were criticizing these injections, such as prolotherapy and prolozone and IV infusions about 15, 20 years ago when I started practice, are now currently trying to take some of the same courses. They're sitting in some of my classes with me and trying to learn some of these courses. And I find it kind of funny how, the trend kind of works. So all of a sudden everybody's wanting to do natural treatments because they know it works. And we can go into the stats here at our office, which if there's anyone out there that really wants to come and see how we do our evaluations, how I kind of pick and choose which patients I want to see, they're more than welcome to call us. So if you have any questions, you can call me at 405-848-7246. Don't let other people scare you. Trying natural treatments are the best route. If medical treatments aren't necessary, I'll help you navigate that decision. So, for example, I have much respect for people that are going through cancer and going to see their oncologist, because I have a father that's going through that right now. ER physicians, I have a good friend that's an ER doctor, and to see what he deals with, I get it. There's a place for all of that. But when it comes to musculoskeletal, soft tissue, autoimmune, there are other options. And at the end of the day, it's your body. You get to decide. And that's where I kind of come into play, is to help you, coach you, teach you, and help you kind of debate. And at the end of the day, you make the decision.